Many people believe that weight loss is simply about eating less and moving more, but there's actually a lot more to it. Tonight, we're speaking with weight expert Dr. Megha Poddar about the science of obesity. Before we get started, tell me in the comments where you're watching from and let us know if it's your first time joining us. Dr. Poddar, thank you so much for being here with us.
Absolutely. Thank you for having me.
So many people believe that eating less and exercising more is all we have to do to lose weight. Why do these methods often fail in the long term for many people?
You're right. So for so long, the narrative around eating less, moving more, that's all anyone ever heard to help manage their weight. And the challenge is that we know that the science behind obesity, why is obesity such a big problem? It's because our body doesn't actually respond to eating less and moving more. The biology is really set up for our body to defend our highest weight. Whenever we start to lose weight, our hormones change, our appetite system changes, our metabolism changes, and all of a sudden our body is fighting us so that whenever we lose the weight, we just end up regaining it. And this is why people have struggled for so long with diet and exercise alone. It just doesn't match the science.
So for that person who's been on a diet and noticed, oh my gosh, I am hungry more now, I'm thinking about food now, it is not their imagination, is what I hear you saying.
Exactly. It's not their imagination and it's not their fault. And this is the fundamental principle to why we call obesity a chronic disease. When you calorie restrict, your body and your brain will fight you, and it'll do so by increasing your appetite. So when you go on a diet, you plateau with your weight and you regain it, or that infamous yo-yoing, that's not your fault. That's how our body and our biology has been built.
So can you talk a little bit about our brain's reward system, how it can affect our food choices, and how it can make it difficult to stick to healthy eating habits?
It's that fundamental mechanism of wanting and reward in our brain that gets amplified when we have obesity. When we try and restrict our calories, the wanting mechanism, the reward we get from food, it's a signal in the back of our mind and our brain to go out and get food. A lot of people will describe this as food noise. It's a subconscious thing that you may not have noticed is happening, but when you lose weight or you calorie restrict, food noise gets stronger and stronger. And you'll find often with our treatments, that's actually the symptom that we're trying to treat. Has your wanting improved? Are you able to now engage in the food behavior that you've been trying to do by reducing calories because we're now treating that appetite system that was driving that behavior in the first place?
We're going to pause here and do our trivia question. If you answer our question today, folks, you'll get our fantastic guide to superfoods, packed with tasty recipes to try. You'll get it for free if you answer our trivia question, which is, true or false, Canada has more lakes than any other country in the world. Is that true or false? Does Canada have more lakes than any other country in the world? Put your best guess in the comments, and you'll get that guide delivered to your Facebook Messenger for free. And folks, if you can think of any friends or family members who might find this show helpful, please tag them in the comments so they can tune in too. Dr. Poddar, you mentioned the term food noise earlier. Can you talk a little bit about what food noise refers to and how it can impact our eating habits?
Sure. So, it's interesting. This term food noise kind of came out on its own. We didn't come up with it on a clinical level or a scientific level, but it came out because once people started treatment, and often that treatment was medication, all of a sudden they were able to describe this thing that they'd never felt before. And the way that a lot of my patients would describe it is this what normal people feel like? There's this weird grumbling noise in the back of my mind, and it was there all the time. And I never realized that I had it until it went away. And so what is food noise? It is this subconscious trigger in our motivation centers of our brain to go out and get food for reward and pleasure. It's subconscious, so we don't actually know that it's there. But what's very interesting is that when you have obesity, we know that people have higher degrees of wanting and reward. The actual biochemical hormones are heightened in that area of the brain. And when you actively try and lose weight through calorie restriction, that reward center gets increased. So the degree of wanting that your brain is really stimulating is in order for you to actually regain the weight. It's a way for our body to defend our highest weight. The actual symptom of obesity, the thing we're trying to treat, is wanting. For so long, we've counseled people that obesity is a chronic disease. And despite our best effort with education and different ways to kind of narrate how that pertains to them, why obesity is a chronic disease, there has been no better way for somebody to truly understand that until they're on treatment. Because you don't know what you don't know and you can't feel your subconscious brain. But when it gets treated, all of a sudden it's like, whoa, I can't believe that's how I was living my life. And this is what it should have been like. There's nothing more powerful than starting treatment to help somebody understand why and how obesity is a chronic disease.
So let's talk about the treatments that are currently available for obesity.
Absolutely. So, in the Canadian Clinical Practice Guidelines, there's essentially three pillars of treatment. The first one is psychological or behavioral intervention. The second one is pharmacotherapy or medications for obesity. And the third one is bariatric surgery. And the reason why you didn't hear me say diet or exercise as one of the treatments is because those are behaviors that are actually outcomes of successful treatment. The three pillars are important because those are the only treatments that have shown to be successful long term. And the reason they're successful long term is because they are all treating the fundamental symptom of wanting or appetite. In the biology and science of why obesity is a chronic disease is because our body will defend our highest weight, and it'll do so by changing our appetite system. So if our treatment does not treat or target the appetite system, it will not help us to be able to manage our weight long term. Psychological intervention targets the appetite system. Medications target the appetite system. And even bariatric surgery targets the appetite system. So these are why those three pillars are the evidence-based ways to treat obesity. If we are successful by using one or all three of these pillars, people will be better able to engage in dietary change and exercise. Those are outcomes of successful obesity treatment.
So, diet and exercise alone almost make the appetite system more problematic, whereas if we're on a treatment, it makes the appetite system less active, so it's easier to do the behaviors like, eating well that we want to do. Am I capturing that correctly?
Absolutely. When we start treatment in a patient and we see them back in 1 month or 3 months, I'm not asking them how much weight did you lose. I'm asking them how close are you to doing the behaviors that you've been trying to do? Do you find that your appetite is better controlled so that you're engaging in the food behaviors that you set out to do? Treatment is a tool to allow us to engage in the behaviors we've been trying to do and allow us to show up to be the people we've been trying to be. If you're simply reducing calories through a diet and increasing activity, you're fighting your body and your brain. And unfortunately, because our biology is so effective, that's the reason we survive. Most people will not be able to reduce their weight and keep it off through diet and exercise alone because you're fighting your body's natural desire to regain it.
So, Dr. Poddar, you and I were recently at a health conference, and a physician on stage was talking about the new medications that we now have available in Canada. And she was saying that what these medications do is work on the brain to make it easier to do the eating behaviors we've always wanted to do. Can you talk a little bit about that?
There's two fundamental ways we're defining success around treatment. One is around behavior. Does this medication help us to do the things that we've been trying to do? Does it help to reduce cravings? Does it help to reduce appetite? Even though we're living at a lower weight, are we still able to maintain a calorie restricted diet without being overly restrictive in a sustainable way? That's what medications really help us to do from a behavior perspective. But independently, Certain medications have also been shown to improve certain complications of elevated weight. So, if you have inflammatory processes that are leading to insulin resistance, we know that certain medications improve the risk of diabetes, fatty liver disease, hypertension, high cholesterol, independent of weight, because it's directly working on certain organ systems. So, a really important part of this journey is understanding how are you going to define what success looks like for you. As a healthcare provider, I want to make sure that I'm helping my patient achieve their goal, but I also want to make sure that I'm helping them be as healthy as they can. And most of these medications help us do both.
Dr. Poddar, I know there's a lot of folks who are very curious about medications and whether they might be right for them. Can you talk a little bit about why it's so important to start the journey with a physician who really specializes in this area and can give you comprehensive care for obesity rather than just trying to get the medication?
This is a question that's near and dear to my heart because I see so many people on these medications now, and it's very interesting. They may or may not actually be feeling any better. And this is because we didn't fundamentally give them the opportunity to understand what is this medication actually treating? What are the symptoms of obesity? How am I going to define what success looks like? In order for these medications to truly be useful, we have to stay on them long term. But nobody wants to be on a medication forever. The only people that want to be on a medication are those that understand and accept how these medications are working in their body and it's worth it for them. And that's the journey that gets missed when you don't have a supportive healthcare provider helping you throughout this journey. There's a lot of online telemedicine companies that are prescribing medications. And because people are so vulnerable and they've tried and tried and tried and they need the help, they're going to these online communities or online services, but they're not getting the true help that we know is out there that they deserve. Because these medications, they're just a tool in the toolbox. They're not a silver bullet. They're not a be all and end all. They're a tool to help us understand the biology of what's happening in your body that's making it so that you're living at an elevated weight. But more importantly, for you to understand, is this medication working and is it worth it for me to stay on? Because it's only once you're on the medication long term and you're able to maintain that weight down that you're actually going to see the health benefits that come from that weight reduction.
So I'm glad you used the words long term when you were talking about how these medications need to be used, because I think that's a common objection for obesity medications is that we have to be on these for the long run. How do you help the people that you work with understand the journey that is obesity treatment and the fact that it is treating a chronic condition long term?
This is a critical discussion because before I start any treatment, I really need to explain what the disease actually is and what the treatment is doing. It's very interesting because when somebody understands and accepts obesity as a chronic disease, they actually don't want to come off the medication because they understand that the medication is allowing me to live at this normal weight and sustain it off because I'm no longer fighting my brain and my body's appetite to regain that weight. And it's a fundamental shift in the thinking because if you believe that this is your fault, this is a lifestyle problem, I can do it, I just need that jump start, or let me just get the weight down and then I'll be able to kind of carry on with my diet and exercise plan. If that's the belief, then you're never going to stay on the medication. And fundamentally, what happens with these treatments is the beginning part is the easiest part. Just like any dietary plan, you lose most of the weight at the beginning, and then eventually it tapers off. Everyone will hit a weight plateau. And that weight plateau where you're doing the same healthy behaviors and you're not seeing more and more weight loss, that is fundamentally happening because your brain is defending further weight loss by increasing appetite and wanting for food. When you are on medication, the medication is allowing that symptom to not be there. You are living at a lower weight and you're not fighting your brain with the increased appetite because the medication is allowing you to fight that fight. If you stop the medication when you're at a weight plateau, you will get more hungry. Your brain is super activated. Without the medication, it becomes very difficult to keep that weight off. Not because you're not trying hard enough, not because you're not motivated, because that's the biology of obesity.
In case you're just joining us, we're here with Dr. Megha Poddar talking about the science behind obesity and why weight loss is about more than just willpower. We're giving away our guide to superfoods if you answer our trivia question, which is true or false? Canada has more lakes than any other country in the world. Is that true or false? Does Canada have more lakes than any other country in the world? Put your best guess in the comments, and you will get that guide delivered to your Facebook Messenger inbox for free. Folks, we do this show every month, and we want to make sure you never miss an episode. Text the word WATCH to 844-966-1957, and we'll send a short text message to you reminding you when we go live each month. Dr. Poddar, why is it important to view obesity medications as part of a broader, comprehensive approach to obesity management?
Medications are simply a tool in the toolbox. Often it's been touted as the silver bullet, all you have to do is get on these medications and everything else will correct itself. But the reality is, these are simply a tool to help us engage in the behavior changes that we've been trying to do. If you're on a medication and you don't have proper support around nutrition and physical activity, then you may not actually be living a healthier life. Just because your weight is lower doesn't mean that you're healthier. Your health is actually defined by your behaviors. What complex obesity treatment is fundamentally doing is helping you engage in the behaviors that are necessary for you to live the healthiest life possible. Whether that is stress management or sleep or nutrition or activity or managing other metabolic issues, it is a chronic, complicated disease because it's not just about losing weight. It's about managing all of the things that are barriers for you to live the healthiest life possible.
So you said that when you're working with people, you're not focused on the number on the scale. You're focused on improving the other conditions like diabetes or high blood pressure that are caused by obesity. Tell us what you mean by that.
So we know that obesity is the root cause for over 200 different complications. When you have obesity, which is defined as inflammatory adipose tissue leading to other health conditions, almost every single other organ in our body can be affected. So when we look at obesity, we have to look at the person as a whole. How much is their sleep impacting their overall health? What's happening with their heart, with their liver, with their pancreas? There are so many complications that can stem from this one disease state that it's sort of unfair to look at obesity treatment in respect to weight loss. We need to look at obesity treatment in respect to health and how sick the person is and how to improve overall outcomes. And so when I talk to a patient, I'm not really asking them to step on a scale. I'm not asking them how much weight did they lose from the last visit. I'm far more interested in their behaviors. Are you moving your body as much as you'd like to? Are you engaging in the food behaviors that you are targeting? And what does your overall health picture look like through metabolic blood work, ECG tracings, blood pressure readings? That's what I'm more interested in because that's what truly matters in terms of the definition of health.
So as a person reaches a healthier weight, what are the other health conditions that can improve?
When a person starts obesity treatment, many health conditions can improve. If you think about metabolic disease, blood pressure, high cholesterol, fatty liver, type 2 diabetes, all of these conditions can improve. From a women's health perspective, PCOS, fertility can improve. From a movement perspective, osteoarthritis and other inflammatory conditions can also improve. You can look at almost any organ system in the body, and you can believe that obesity is a risk factor for a downstream problem in that organ system because of the chronic inflammatory nature of this disease.
So how can reaching a healthier weight help with heart health over the long run?
Being at an elevated weight is directly proportional to poor heart outcomes. And that can be in a variety of different ways, whether it's cardiovascular disease or atherosclerotic disease, where there's actually plaque deposited in the arteries, leading to things like myocardial infarction or heart attack. Probably the most scary of heart conditions related to obesity is something called preserved ejection fraction heart failure. This is where our heart is actually having difficulty relaxing because it's enlarged. And it can present with symptoms that are not so obvious: shortness of breath, difficulty with mobility, not really the classic heart symptoms, but we don't have great treatment for this condition. And obesity is one of the main risk factors. So, a lot of the research and outcome data that we're now looking at for obesity is looking at improving outcomes in people with HFpEF, or preserved ejection fraction heart failure. Other conditions are arrhythmias or irregular heart rhythm, like atrial fibrillation, flutter. This will present in a way like having palpitations or an elevated heart rate. But in general, people living with obesity do have a direct correlation with increased risk for heart disease.
And I think one of the things we're learning as well is that obesity medications in and of themselves can help improve our heart health even before we start losing weight. Is that correct?
Absolutely. One of the greatest trials that recently came out in the obesity space was the first time we were able to show in people without diabetes being on a medication to manage obesity decrease your risk of heart disease. And this is in the highest risk population. Those people already had established heart disease. And so what we're now seeing is when you're on effective treatment, you're able to see not only being at a lower weight, but actually seeing these complications directly related to your heart improve. And now, for the first time ever, we're starting to have indications for treatment for obesity for specific disease states. So, with that medication, if you have established heart disease and have obesity, then that is the first line treatment for you because we know that it will have a direct impact on your quality and quantity of life related to heart disease.
So, Dr. Poddar, you said earlier that you're focused on improving the overall health of your patients, but I'm guessing that some of them probably are still pretty focused on the number on the scale. How do you have conversations around expectations of what success looks like?
This is a great question because it's super hard. I think for many people, that number on the scale really means something. But often, what I'll do is I'll try and dig a little bit deeper. When you were at that weight that you're trying to get at, what was your life like? How were you feeling? What are the things that you were doing that made you feel more like who you're trying to be? And it's very interesting because when you dig a little bit deeper and you poke a little bit more, there's a true understanding that maybe you don't have to be at that weight to have that same feeling, to have that same amount of health. Often we'll relate that number to feeling better and who we're trying to be. But maybe it was more about, I was able to get up, I felt good, I was able to go out for a walk without any pain or shortness of breath. Well, maybe we need to work on those behaviors and getting your body able to do those things so that you can start feeling closer to who you're trying to be instead of focusing so much on the weight. Because the one thing in this whole journey that we don't have any control over is what the weight's going to be. And so we put so much emphasis and our entire success on something we have no control over. That's a recipe for disaster and for feeling like a failure, even when treatment is successful. So it's a hard thing to do because as a society, we're very tied to numbers, and the scale has an interesting relationship with our values. But once somebody has let go of it, it's a dramatic relief because now you're just able to execute on what you're trying to do, and you're not putting so much emphasis on an external factor that you didn't have control over in the first place.
Dr. Poddar, thank you so much for joining us tonight. This has been such a wonderful conversation.
Absolutely. Thank you for having me.
And a big thank you to everyone watching at home. We so appreciate you being here and chatting with us in the comments. Before we go, here's the answer to our trivia question. True or false? Canada has more lakes than any other country in the world? The answer is true. If you didn't get to answer the trivia question, but you'd still like our guide to superfoods, just leave a comment for us and tell us what you thought of the show. We will be back to you with a new episode in a few weeks. Until then, please stay safe and take good care. Good night.